to keep this monthly webinar series going. And again, we try to vary topics and speakers. So this month, I'm really excited to have JoDee Winter, who's a physician assistant and instructor with the Department of Neurosurgery at the Mayo Clinic in Arizona. She also serves as the program director for the Neurosurgery Physician Assistant Fellowship. And she's also the president-elect for the Association of Neurosurgical Physician Assistants. So we're really thrilled to have her give her time and, talk a little bit about her role as a physician assistant and her interaction with brain aneurysm patients. JoDee, thank you so much for doing this and sharing your time with us. We're excited to have you.
Thank you, Christine. I appreciate the offer.
Great. So I'll just kick right into it. And some of you I know sent some questions when you registered. Some of those we'll go over, and Lynn is going to be monitoring the chat as well. But first question, JoDee, can you tell us what a PA is and how it differs from an MD and an NP?
Yeah, absolutely. Well, let's take each one separately. So a MD is a medical doctor. They are folks who have gone through undergrad, medical school, and then apply through residency in a specific specialty. In the case of neurosurgery, residency is 7 years. And then following residency, they most likely will be doing a fellowship, especially if they would like to work in aneurysm care. That is a fellowship, an additional 1 to 2 year fellowship in order to practice. A nurse practitioner is a registered nurse who has completed their bachelor's degree and has decided to further their education, either with a master's degree or now a doctorate program. And they go through training through nursing school that teaches them the art of becoming a practitioner. At the conclusion of their training, they may then begin to practice medicine on patients. Nurse practitioners, unfortunately, that part of their training does not include surgical skills. So if they want to do things within a surgical subspecialty, they must do additional training in that field. The unique thing between a nurse practitioner and a physician assistant is in some states, nurse practitioners can work independently, where physician assistants, which we'll talk about in just a minute, must work with a supervising physician. As far as PAs, most of us have an undergraduate degree in some medical profession. Some are pre-med, some are pre-PA, depending upon how your program works. And then they apply through physician assistant school, which varies in length anywhere from about 27 months to about 3 years. There are a few programs out there, mostly on the East Coast, that are a 5-year BAMS degree. BSMS degree that do both the bachelor's and master's degree all in that 5-year time frame. And then once they finish a physician assistant school, then they are once they pass the certifying exam, then they can go out and practice. When I finished, there weren't a lot of residencies or fellowships for PAs, but now that's becoming quite popular. We currently have the only neurosurgery physician assistant fellowship in the country, but there are others that are coming aboard.
All right, thank you. That's very exciting that you guys have that fellowship
Yeah.
there. And it's good, I think, that more are coming down the pike, because just even I'm on the East Coast, just the role of both NPs and PAs and, in many fields seem to just be really taking off and growing. So that's really exciting.
Absolutely. It's one of the fastest growing professions.
Oh, really? That's awesome.
Mm-hmm.
Okay, so at what points of care do PAs generally get involved in treating or being with the brain aneurysm patients?
So in our program, we can be involved at any step of the way. We see patients in the outpatient clinic along with our physicians. And so we can see you on your initial consultation. We can follow you into surgery if need be, and then we can follow you through your postoperative care in-house and as an outpatient. If the patient presents through the emergency room, we are usually the first point of contact there until the physician arrives, and then they start to go through care that way, and then they're followed throughout their hospital stay by a member of our team along with the supervising physician.
Thank you.
Mhm.
What do you think the benefit is of the PA's role in the care track? And do you think the role of the PA is evolving?
Yes, I think the role of PAs are evolving every day in every type of care track. The physician assistant from where it started 50 years ago is very different than where it is now. Most of the PA programs were started to help fill a void, coming back from the Vietnam War where they needed healthcare practitioners and they just weren't having enough people graduating medical school. And so when the PA profession started, um, from where it has gone to now is vastly changing, and it changes every year. Surgical subspecialties are something that has come on in the last 25 or so years as an avenue for physician assistants. Most of them in the original were in primary care settings, and now it's evolved that physician assistants are involved in pretty much almost every aspect of healthcare. There is still a few in anesthesia. It's just not as popular as it is for CRNAs.
Thank you. And I'm assuming that the physicians must see this as a great benefit to have a PA in
Yeah,
the practice, just in terms of alleviating the workflow and just giving kind of better care and more time to patients.
absolutely. In our practice, we have 10 surgeons and 12 PAs, and we have one MP that works with us. And, we help with all aspects of the care, outpatient care, inpatient care, in the operating room. We provide an extra set of hands, another person for the patient to have as part of their care team to reach out to and kind of overlap and make sure that they get the best care possible.
Great. What would you tell patients to put their mind at ease if they're apprehensive about meeting with the PA versus the doctor? I think it's more of a old school thought. I feel like, the younger generation and even middle-aged people like myself, it's, you feel good about it. But what do you tell people that just sort of feel like maybe they're not getting the full attention that they deserve?
Absolutely. I always explain to people if they don't know what a PA is, what I do, what my role is. If they ever are apprehensive or have additional questions, our physicians are always available that I can go, have one of them step in and answer questions. All of our physicians are incredibly supportive of each of us. So, when they do come in, they're like, "Oh, you've met my PA, JoDee, and if you think, she can answer your questions as well as I can." Or, I think it helps. That sets a tone for the patient as well. And I think after they get that experience, they learn that PAs are a very valuable member of their team.
Yeah, I mean, I totally agree. I think it's great again in any level of care. And I just feel that PAs and MPs as well seem to just have maybe a little bit more time and a little bit more
Mhm.
of that touch that, particularly a surgeon sometimes coming in and out. Nothing against the surgeons that take good care of everybody, but I definitely think there's so much value added. So it's nice to
Definitely.
see in this space that that's happening. Do you think there might be a way for the BF to work with PA associations to help educate and raise awareness? Because again, we mentioned that you're part of the Association of Neurosurgical Physician Assistants. So, I mean, I think that I would love to hopefully think there might be some ways we could collaborate on this.
Yes, absolutely. We would love that. As part of ANSPA, I am in charge of our annual meeting. I'm the educational chair. And so setting up educational opportunities between ANSPA members and the BAF would be great. We try to arrange our own webinars. As spotty as they may seem, you
Yeah,
are much better organized than we are about that. But I would love to set up a webinar just to get some awareness out there for our members about your foundation. I'm not sure how many of them are aware of all the things that you can do and all the things that you're involved in that
great.
would benefit them and their patients.
Yeah, that would be fabulous. Again, the key is education. And like you said, in an ER, a PA might be the first person to see somebody that might be exhibiting signs and symptoms. So again, the
Absolutely.
sooner that these people can be diagnosed and get right to treatment would be fabulous. So what have you learned from working with brain aneurysm patients, and what do you think is most important for them to know in their recovery journey?
Um, a biggest thing I always try to tell them is be patient. People want to see results immediately, and you don't always see that. In our patient population, we see quite a few aneurysm patients. We have a very active transplant program at our hospital. It's one of the busiest renal transplant programs in the country. And so we see a lot of aneurysm patients early, which is great. We catch them early. We try to get them treated before we have any issues of them showing up in the emergency room. And so I think that is something that I've learned is that, not all patients show up in the worst case scenario. They show up and they're ready to get this taken care of so they can move on with their lives. They can get things taken care of so they can have their transplant in some aspects. But if you were to show up in our emergency room, be patient. We will work with you every step of the way to try to get you back as functional and as ready to take on the world as you were before you started this.
Thank you for that. And then are there any events in your area for brain aneurysm awareness coming up that you would like to mention?
Well, as
There
you
might be.
mentioned, there
Uh,
might be. So just so all of you are aware, our department holds a annual meeting every year. This year we are holding it at the Boulders Resort in Scottsdale the first week of April, April 4th through the 6th. And as part of that, on Saturday the 6th of April, the Brain Aneurysm Foundation and our department are partnering for a walk to bring up brain aneurysm awareness and a hike. I guess we should call it. It's a
yes.
little more than a walk. I just did it on Saturday, so but I think it'll be beautiful. It's up up on Pinnacle Peak trailhead up in North Scottsdale, where it's beautiful. It's going to be a perfect time of year to be in Arizona. It's temperatures are going to be in the 70s. It's sunny, it's warm. It's a beautiful time of year to be in Arizona and a beautiful time to come and hike with us on Saturday, get to know some other people who work in neurosurgery and with aneurysm patients. We're going to invite anybody who would like to come. Please join us.
Awesome. Thank you. Yeah, we're very excited about that. And it was on the initial planning call with Dr. Bendock, who's out there, who I've known through many years and was a research grant recipient with the foundation when we were having this hike planning walk, that I met JoDee, and I said, oh, I have an idea for you. Maybe we can get you on a webinar and talk a little bit about what PAs are doing. So I'm glad that that worked out. So that's wonderful. And actually someone in the chat, JoDee, would like to know a little bit about the neurosurgery fellowship through the Mayo Clinic.
Oh, absolutely. Our fellowship is a 1-year fellowship. We just recently, as of this year, started it. It starts now in October. So it runs from October to October, and applications are open from November through the end of April. It is a stipend position, so the fellows are paid a stipend for their year, and included in their reimbursement is reimbursement for their DEA license, which is a requirement. And then you also get one paid CME meeting per year. As part of the fellowship, we do rotations in all parts of neurosurgery. So not only brain and spine, but we also do all parts of through an ICU, a neuro ICU, a neurotrauma. Neuroradiology is part of the rotations. We do a PM&R rotation, a pain medicine rotation, and then we have time that we spend at our children's hospital, because Mayo in Arizona does not have a children's wing. So we partner with our local children's hospital for our fellowships to go spend a month there to spend some time learning about the pediatric aspect of neurosurgery as well. Any additional information you want, please don't hesitate to reach out. I'm happy to answer any questions. I can put my email in the chat, and you
That'd
can
be
send
great.
me an email anytime.
Yeah, because this person is a current clinical year PA student.
Oh,
Interested
great.
in
Well,
pursuing
welcome.
neurosurgery, and their mom has had many endovascular surgeries for a brain aneurysm.
Oh, great.
Yeah, and the team of PAs at the hospital were amazing, so that's
Oh,
why.
that's great
Yeah.
to hear. Well,
Yeah.
welcome, Kaylee. And there is my email address. Please feel free to reach out. I'm happy to send you more information anytime.
Here's another question is what is the average turnaround time to hear back from a PA about concerns a caretaker may have?
It depends.
Yeah,
It's a good answer.
yeah.
Usually we try to respond within the same day if it's during the weekday. Um, that being said, that we are also in and out of surgery, so it may be a few hours before we can get back to you. At night and on the weekend, it's a little bit harder. Unless you specifically go through the on-call line at our department, you may not hear from someone until Monday. If you go through the on-call department, you should hear back within 30 minutes to an hour.
Someone else was wondering if you do any research or if any PAs do research on brain aneurysm treatment or diagnosis or part of, a group that's doing it.
Yes, actually, our department is very heavily involved in research. Most of our research projects in our department may not always be aneurysm triggered, but all of our research in our department, Dr. Benduck is very much inclusive, would like to include a PA or an MP, as well as one of the residents in each of his research projects in order to get everyone as much exposure and ability to do research as they can.
That's great. Thank you.
Mhm.
And someone was wondering, can brain aneurysms or AVMs occur before birth? And can that be the cause of some in utero strokes?
That is a great question. I actually do not know the answer to that, but that could be a possibility. Some aneurysm.
The dogs came to visit today.
Oh, hold on, I'm gonna mute.
Oh, those the therapy dogs? Yeah.
There we go.
No problem. I don't know the answer to that question, but that is a great question. We do know that there is a genetic component to aneurysms. So it could be something that could be quite the research project actually to
Yeah,
see if that is something that is a correlation for sure.
yeah. And someone is just asking, someone on here is in Arizona. So we
Oh,
don't know exactly where yet. Do you know what was the mountain you were at this weekend?
we were at Pinnacle Peak Trail. It's in North Scottsdale. If you're familiar with Scottsdale, it's in true north. That's
Okay.
the one we were at last Saturday. The Saturday before, there is a hike right around the Boulders Resort that they did that Saturday. I was unable to participate then. So we're trying to determine which one would be better for the hike, but either one would be great.
And I think it's going to be, Lynn is putting it in the chat for anyone who's in the area. You'll see it on our social media and email blast. So it's April 6th, and we're just trying to hone the exact location. So, yep, if you're in the area, you know anybody, spread the word. So,
Absolutely.
yeah.
Hang on one second and I'll just show you the, oh goodness. Let me give you I can't
Yeah,
share
make
my
it your
screen.
co-host. There you go.
Okay, perfect. I was just going to show and the website for our meeting, which will also have updates on it.
Oh, good. That's a good idea. Yeah.
Let me grab that for us. Hold on. Sorry, I am technologically challenged some days. Give me one second.
Nope, no problem.
Okay, you can keep talking while I try to figure this out.
No, that's
Sorry.
no worries. Well, I did have another question here.
Absolutely.
And someone is just saying, if they're getting 3 different opinions for endovascular options, how do you know what decision to make?
I think honestly, are you getting 3 different opinions? That's the thing. In our case, we do get quite a few people who come for a second or even a third opinion because they think coming through Mayo is going to give them a different opinion. I think honestly, you have to be comfortable with the decision you're making and with the team you're making that decision with. I think that it's important for you to get the care that you want. You want somebody who's going to answer your question, who's going to be there for you, who has the experience to take care of your family member that is going through this. You want somebody who knows what they're doing and that they're very experienced at this and knows the pre-care and the post-care for brain aneurysm patients.
Yeah, excellent. Thank you.
Absolutely.
After a ruptured aneurysm is clipped, how often should it be checked and by what doctor?
So we check them usually at about the 1 month mark. After they leave the hospital, we've checked them within the hospital, usually with a CTA the following morning, and we may follow that with an angiogram while they're still hospitalized, just making sure that everything stays looking the way it's supposed to. We usually check it again in about a month with another CTA or an MRA. And then Dr. Bendock's protocol is usually at about the 3 month mark with additional imaging, at the 6 month mark, and then at the year mark. And then after that, he usually can stretch it out depending upon other risk factors or different things that he's seen while he's in there. Sometimes it's once a year. After a while, he'll stretch it out to every couple of years.
And then someone is wondering if their doctor gave them the all clear and they're 5 years out. I'm not sure if they were clipped and coiled. They were just wondering if they should be followed up.
Usually at that 5 year mark, we don't follow them as frequently unless they begin to have other things going on. The biggest thing that Dr. Bendock also likes, and he's who I've worked with, so I'm not
Right.
sure how everyone else does this. He also is very big on making sure that family members are screened. If we see someone who has an aneurysm, we want to make sure that they are letting their family members know so that they can be screened. And the younger you're screened, the earlier we find these, the smaller we find these, the better it is, so we can follow them.
Well, that's good to hear. And that's one thing it's funny about this disease. There's so many unknowns in terms of when they form, why they form, will they rupture, will they not rupture? And certainly even in the medical profession, the doctors definitely have different protocols and different thoughts. So it's nice to hear that Dr. Bendock feels strongly about family member screening, because we go to Capitol Hill every year and we have a legislation called Ellie's Law to get more money from NINDS specifically for brain aneurysm research funding. But part of those conversations that has come up a lot, and it's definitely hard on Capitol Hill to get things you want right away, but something that's really resonated in these meetings is because the general rule of thumb is if there's 2 or more people in your family, and that's primarily due to insurances and whatnot, that people can't believe it. When someone is listening to either someone that lost somebody or somebody that survived and, is struggling in their new normal and their new life, they just can't seem to understand why would anybody wait for that second person. So again, hopefully through research, actually someone that we funded and have funded for quite a number of years, from Buffalo, just got a $2.9 million grant from NIH to continue his work on trying to identify a blood-based biomarker. So hopefully it won't be that scanning, that we will get to that point of using blood work to determine. And I think definitely with when it runs in families, or if people don't even know and they find out later, and that's, we hear these stories all the time. So I'm just happy to hear that he's very proactive and that side of things, because I think it makes a world of difference. And it's part of, again, in our mission is when talking to different people, it's that early detection. And for a disease that is so very treatable, it's just a shame that so many people don't know that they have it. So, so that was definitely good to hear. Another question is, someone is wondering, what is good blood pressure for somebody? They're saying that, this is a specific sort of question, is 130 systolic too high? They're asking, or what should they do if they have unruptured aneurysms and they're worried about their blood pressure? What would you recommend? It's probably a better way.
We recommend for folks that are untreated blood pressure less than 140. Once in the first 24 hours after treatment, we try to keep them a little bit lower. We like to keep them 100 to 140, mainly just because we don't want anything putting any increased pressure right where we were working. Usually after that, we can start to relax our blood pressure, but we still would like their blood pressure less than 140. I kind of tell people, if you can imagine an aneurysm is like a balloon, and every time your heart beats, you're putting more pressure on that balloon. Well, the harder it's beating, the more pressure you're putting on that balloon. And every time you increase that pressure, you're increasing your risk of rupture. So the lower is the better, but definitely less than 140.
That's good. Thank you. And someone is asking, just in general, is there a way anyone can prevent or protect themselves from a possible aneurysm?
Unfortunately, if we knew all of the reasons and things that would cause them, I would say yes. But the biggest thing is a huge thing is know your family history if you can. Keep your blood pressure under control as much as possible. Screening is a great thing, but it's not always paid for if you don't have a reason for it. So, biggest thing is just kind of keep the things that you can keep under your control. Keep your weight under control, keep your blood pressure, your diabetes, your cholesterol under control. Those are the things that you can control. You can't fight your genetics, as I like to say, but if you know that there's somebody out there that has in your family that has had this, it's worth mentioning to your primary care provider to let them know so that they can go about what they need to do to get you screened properly.
Great. Lynn, you have a couple more you see in the chat?
Yep.
Feel
Yep.
free.
One says, do you have any preferred guidelines for aneurysm care with medical management versus surgical management?
Any particular guidelines? So usually, when it comes to medical management, screening is the biggest thing. Once you're screened and we follow you, then we kind of keep an eye. Usually it's about every 6 months for the first couple of years. If we don't see anything growing in that particular time, we can start to stretch it out a little bit. Always knowing that they're there. But if they're not growing and they're stable, we may not have to ever do anything about that. So by medical management in that aspect is to keep your blood pressure controlled, keep the risk factors that you can control under control. If you know you have an aneurysm and we have been watching it and it's slowly growing, know there may come a time where we need to intervene on this. And when we do, you have options of ways to intervene. And so, make sure you are exploring all of those options with the surgeon or the endovascular person that is taking care of you in order to make sure you're getting the best option for you.
Great, thank you. And then there's another one. Is there any current research on connective tissue disorders such as vascular Ehlers-Danlos syndrome and the relation to cerebral aneurysms and how that may affect screening?
Christine, you can probably better answer that than I can. I'm sure you guys have quite a bit of research in this and in this area because it is such a common occurrence.
Yeah, I don't know the specifics. Again, that's something that we can get back to Kaylee on. There's definitely a relationship between the diseases, but what the current research is, I can't state right now either, but it's something that I can look into. And Kaylee, if you want to email me, I can get you some more information from our researchers who definitely know more, but I'm sure there is some things that are going on that I could share with you. Well, I think we covered most of the questions that came in, unless any come into chat, but I just wanted to ask if JoDee, if AI plays a role in your diagnosing and treatment of patients at this point.
No, not yet. We do use some sort of, we use something called, and I don't know if you've heard of this, surgical theater. We use a lot of interactive. It's not so much AI as it is interactive, where we can actually use technology that overlays an individual's MRI and their aneurysm, and we can create a 3D model that then you can put on a HoloLens on, and you can actually walk through your aneurysm, and you
Oh,
can
wow.
see how it looks from all the aspects. The surgeons can use that to help determine, as they're trying to plan the surgery, which, what is their best route to get there, what is their best way to get there, and how to best, if we're going to clip, where's the best place to place the clip in order to isolate the aneurysm. It's a newer technology that we've been using for about 3 years, but recently, within the last year, it's become integrated so that we can actually use the technology while we are actually under the microscope in the operating room. We can overlay the information real time and kind of see where we are in relation to where we need to go.
Okay, that's exciting.
Mm-hmm.
Yeah. I think we covered most of the questions, so I think at this point we can wrap up. JoDee, any parting words?
No, thank you all very much for your participation, and thank you, Christine and Lynn, for the invitation.
Oh, there you go.
Oh, there, sorry, I accidentally hit the mute button. But thank you. I appreciate the time, and I appreciate the opportunity to speak.
No, thank you. We really appreciate it. And again, it's nice to hear about these different roles. And I mean, again, surgeons have a tough time. They need help. So I think the roles of the PA certainly do make a difference. And I definitely want to talk to you about the Neurosurgical PA Association and how we can collaborate and share, just the basic stats and information and knowing the signs and symptoms, because, that is key. And again, if one person can get to treatment sooner or be sent for a scan and not sent home, that would make a huge difference. So I look forward to seeing you in April in Arizona, wherever this hike may be, but definitely looking forward to it. But again, thank you for your time. Thank you for sharing. Thanks for everything.